2025 International Conference Poster Presentation: The Impact of Verbal Violence Experienced by Health Science Students During Clinical Practice on Self-Esteem. Presenter Lee, Sunmi, Department of Dental Hygiene, Kyungnim College of Information and Technology, Republic of Korea. Background and purpose: dental hygienists frequently interact with patients, caregivers, and healthcare professionals, and in this process, they may encounter both physical and verbal violence. Among these, verbal violence can inflict psychological harm such as humiliation and anger. Health science students, including dental hygiene majors, are often exposed to verbal violence during clinical training, which may undermine their emotional stability and self-esteem, leading to decreased self-efficacy and professional confidence. This study aimed to examine the impact of verbal violence experienced by health science students during clinical and to provide foundational data for creating a healthier clinical training environment. Subjects and methods. From October to November 2023, a survey was conducted with 250 health science students at K University, and 238 valid responses were analyzed. The survey instrument included 5 items on general characteristics, 26 items on verbal violence, and 25 items on self-esteem, all measured on a 5-point Likert scale. Data were analyzed using SPSS version 26.0, employing frequency analysis, t-tests, one-way ANOVA, correlation analysis, and multiple regression analysis. Results. 1. Students reported higher levels of verbal violence from healthcare professionals than from patients and caregivers. 2. Fourth-year students and nursing students reported the highest levels of verbal violence, while dental hygiene students reported the highest self-esteem, with nursing and clinical pathology students showing relatively lower levels. 3. Verbal violence from healthcare professionals had a significant negative effect on self-esteem. 197 P-05, whereas verbal violence from patients and caregivers showed no significant relationship. Conclusion. Health science students are exposed to various forms of verbal violence from both healthcare professionals and patients' caregivers during clinical practice, which negatively affects their self-esteem. Therefore, educational programs addressing the prevention and management of verbal violence should be implemented prior to clinical training. Such initiatives may help protect students' self-esteem and support their development into competent healthcare professionals.